Hello everyone. Today we are going to study about physiology and management of normal puerperium. That is postnatal period. Okay, puerperium is postnatal period. So in the normal postnatal period, what are the physiological changes happen and how we can manage them, that we are going to study in this unit. The first one is introduction. The puerperium is a period of approximately 6 weeks which commences following completion of third stage of labor. During this time, the woman recovers from the stress of pregnancy and delivery, and the physiological adaptation which occurs during pregnancy subside and facilitate the restoration of the non-pregnant state. So after the delivery, the first 6 weeks of time is called as puerperium or postnatal period. So in this period, whatever changes happen during the pregnancy, it will come back to the non-pregnant state. Next we'll have definition. The first one, the puerperium is defined as the 6-week period commencing after the complication of third stage of labor. Okay, after the third stage of labor, means after the delivery of the baby until the 6 weeks of time, we'll call it puerperium. Okay. Another definition is the puerperium is referred to the 6 periods following the childbirth when considerable adjustment occurs before return to the pre-pregnant state. And we have another definition. Puerperium is defined as the time from the delivery of the placenta through the first few weeks after the delivery. So these are the three definitions. You can refer any two. So it is a period where after the delivery of the child, during which the body tissue, especially the reproductive system, revert back to the pre-pregnant state, both anatomically and physiologically. Like you know that during the pregnancy, mainly the reproductive organs will get bigger in size. So during this period, it will come back both anatomically and physiologically to pre-pregnant state. And it is a period of adjustment after the pregnancy and delivery when anatomical and physiological changes of pregnancy are reversed and the body returns to the normal non-pregnant state, mainly reproductive organs. Next we have stages of puerperium. So the postpartum period has been divided into 3 stages. One is immediate, early and remote. Immediate would consider the first 24 hours after the delivery of the baby, when acute phase anesthetic or post-delivery complication may occur. The first 24 hours will say immediate puerperium. The early puerperium is which extend until the first week of postpartum, is first 7 days, and the remote is first 6 weeks. So this is the stages of puerperium. Next is in the reproductive system, what are the changes happen? Mainly in the uterus, there is a involution process, is the return of the uterus to a non-pregnant state after the childbirth. An involution process begins immediately after the expulsion of the placenta with the contraction of the uterine smooth muscle. So immediately after the delivery of the placenta, the involution process start. Involution process means the process where the uterus come back to the normal state. At the end of the start stage of labor, the uterus is in the midline, about 2 cm below the level of umbilicus, and it weighs around like 1000 gram. By 24 hours postpartum, the uterus is about the same size and it was at the 20 gestational weeks. The fundus descend about 1 to 2 cm every 24 hours, and by the 6th postpartum day, it is located halfway between the symphysis of pubis and the umbilicals. It means like in every 24 hours by 2 cm the fundus height will decrease. It is not like this suddenly immediately after the delivery the fundus size will come back to normal size. Like daily in 2 cm or 1 cm it will decrease. The uterus lies in the true pelvis within 2 weeks after the childbirth. So involution of the uterus return to the pelvis by about 2 weeks, be at normal size by 6 weeks, and the weight changes of uterus like 1000 gram immediately after the birth, 500 gram by first week, 300 gram by 2 week, and 50 gram by 6 week. And the endometrial lining rapidly regenerate by 16 days, and the placental site undergoes a series of changes in the postpartum period. If you see this picture, you can see how the fundus height is reducing in every 24 hours by 1 to 2 centimeter. Okay. So, its fundus level approximate that of 20 weeks of pregnancy at the level of umbilicus. At the end of first postpartum week, it is palpable at the symphysis of pubis. And autolysis means it is a self-destruction of excess hypertrophied tissue. And what is the meaning of subinvolution? If the involution process not happen properly, means the failure of the uterus to return to a non-pregnant state, then it is called as subinvolution. The most common cause of subinvolution are retained placenta, fragments and infection. It means if anything, any part or any bits of placenta is still in the abdomen of the woman, or if there is any infection, it can cause subinvolution of the uterus, means the process of involution will not happen. Next is contraction. The hormone oxytocin strengthens and coordinates uterine contraction, which compress blood vessels and promotes the homeostasis. During the first 1 to 2 postpartum hours, uterine contraction may decrease in intensity and become uncoordinated. Exogenous oxytocin is usually administered immediately after the expulsion of the placenta to maintain the uterus firm and contracted. Okay, like after the delivery of the placenta, will administer oxytocin. Why? To make the uterus firm and contracted. And mother are encouraged to put the baby to breast immediately after the birth to stimulate the release of oxytocin. Next is the placental site. So in the placental site, what happened immediately after the expulsion of the placenta and the membrane, vascular constriction and thrombosis cause the placental site to be reduced and to a irregular, nodular and elevated area. Upward growth of endometrium causes the slugging of necrosis tissues and prevents scar formation. Endometrial regeneration is completed by the postpartum day 16, except the placental site is not complete until the 6 weeks of delivery, means 6 weeks after the birth. Next we are going to see about the lochia. What is the lochia? It is the uterine discharge that occurs after the birth, and lochia is initially bright red, changing later to a pinkish red and reddish brown. So lochia, it is a, you can say it's normal things. Okay, what's happen after the delivery? Okay, discharge from the vagina, and in the beginning time it will be reddish color. Okay, later it will be pink red, and then later it will be reddish brown. For the first 2 hours after the birth, amount of lochia should be about that of a heavy menstrual period. Like during the period, how much bleeding occurred, no, that much amount of lochia should be discharged first 2 hours. After that, the time the lochia flow should be steadily decreased. Then slowly the amount of lochia should be decreased. It has 3 phases: lochia rubra, lochia serosa and lochia alba. First one is lochia rubra. It consists of blood, decidua and the trophoblastic debris, and it lasts for 3 to 4 days after the childbirth. Second one is lochia serosa. Okay, after 4th day it started, and it consists of old blood, serum leukocyte and tissue debris, and the flow become pink or brown, and it is expelled 3 to 10 days of postpartum. Means first 3 to 4 days what discharge is there, that is called as lochia rubra. After that 3 to 10 days whatever discharge is there, that is called as lochia serosa. Next one is lochia alba. It consists of leukocytes, decidua, epithelial cell, mucus and bacteria, and it is yellowish to white in color. Okay, after 15 days. So from 10 to 15 days this lochia alba will be discharged. Lochia alba may continue to drain for up to and beyond 6 weeks after the childbirth. The amount of lochia is usually increased with the ambulation and breastfeeding. Okay, and the first instance of lochia rubra early in the postpartum period suggests continued bleeding as a result of retained fragments of the placenta or membrane. And another common source of vaginal bleeding is vaginal or cervical laceration. Means see, if it is normal bleeding for 3 to 4 days, we will consider it is lochia. Okay, but if it is more, it means there is a something inside, like maybe some infection or maybe some injury happened. That's why the bleeding is more. The next change occurs in the cervix. So first we have studied about the uterus. Now in the cervix. In the cervix what happened? It is soft immediately after the birth. The cervix after the lower uterine segment remains edematous and thin for the several days after birth. The cervical os, which is dilated to 10 centimeter during the labor process, it gradually gets closed, and it may still possible to introduce two fingers into the cervical os for the first 4 to 6 postpartum day. So what happened during the time of delivery? The cervical os is dilated up to 10 centimeter, but slowly it will get closed, and at least after 4 to 6 weeks we can see there is at least 2 centimeter of gap in the cervix by introducing the two fingers. The external cervical os never regain its pregnancy appearance, and it is so longer shaped like a fish mouth, and it returns to the normal state at 4 weeks after the birth. Next, in the vagina. The greatly distended smooth wall vagina gradually returns to its pregnancy size by 6 to 10 weeks after the childbirth, and the mucosa remain atrophic in lactating women at least until menstruation begin again. Okay, and thickening of vaginal mucosa occurs with the return of ovarian function. The next one is pelvic muscular support. The supporting structure of the uterus and the vagina may be injured during the childbirth. The supportive tissue of the pelvic floor that are torn or stretched during the childbirth may require up to 6 months to regain. Okay, like if any injury, any rupture happen in the muscular area in the muscle, it takes at least 6 months to repair. And women are encouraged to do Kegel exercise after the birth to strengthen the muscle of perineum. Next one is perineum. Swelling completely gone within 1 to 2 weeks, and the muscle tone may or may not be returned to the normal depending on the extent of injury. So how much injury happened, based on that the muscle tone will be returned to the normal, or it will take some more times, but the swelling will go by 2 weeks. Next changes occurs in the breast. Okay, already we have studied that. In the breast what happened, I have this you can see this number. Okay, the ducts, the lobules, the dilated section of the duct to hold the milks, nipples, fat and pectorals, major muscles, chest wall. Okay, and enlargement like normal duct cell, basement membrane and lumen. What happened in that time? See, during the pregnancy itself the breast will start to prepare for the breastfeeding. Okay, so what happens in that, it will be tender, and the areola will be like black color, and it will be ready for the breastfeeding to the baby. During the pregnancy, estrogen and progesterone secreted by the placenta prepare the breast for the lactation, and the estrogen inhibits the milk production until the end of pregnancy. And in the third trimester of pregnancy, the colostrum, that yellowish color milk, is present, and the remain for the first 3 days of postpartum. Here are some positions for the breastfeeding. One is cradle hold position, football position, cross cradle position and lie down position. Okay, and one more thing is very important, that is good attachment. You can see in this picture the nipple should be fully inside the baby mouth. Okay, the areola should be fully inside the baby mouth, then only the baby will suck properly and milk will be produced or secreted properly. So for today's this much is we have studied after the this changes in the breast. In the next video we will explain about the remaining changes, physiological changes that occurs in the postpartum period. Thank you everyone.